Good morning and welcome to the 26th meeting of the Public Audit and Post-Legislative Scrutiny Committee in 2020. Before we begin, can I remind members, witnesses and staff present that social distancing measures are in place in committee rooms and across the Holyrood campus. In addition, a face covering must be worn when moving around, exiting and entering the committee room, although they can be removed once you are seated at the table and in the committee room. Can I also remind all those present to turn all electronic devices to silent mode so that they do not disturb the committee's work. Agenda item 1 is a decision on taking business in private. Do any members object to taking items 3 and 4 in private? And if Colin Beattie, Alec Neil, Neil Bibby or Willie Coffey, who are joining us remotely, object, please raise your hand. I confirm that is agreed. Agenda item 2 is looking at our key audit themes, and today's theme is data collection and planning for outcomes. Can I welcome our witnesses, Stephen Boyle, Auditor General for Scotland, who is joining us in person, Alex Hutchison, Director of the Data Collaborative for Children with UNICEF, the Data Lab, who is also joining us in person, Linda Hutton, Research Team Manager at Citizens Advice Scotland, who is joining us remotely, Dr Emma Miller, Senior Research Fellow, the School of Social Work and Social Policy at the University of Strathclyde, representing Personal Outcomes Network, also joining us remotely. Claire Sweeney, Director of Place and Wellbeing, Public Health Scotland, who's joining us remotely. And finally, Jennifer Wallace, Head of Policy at Carnegie UK, who is also joining us remotely. Stephen Boyle and Alec Hutchison, just note that when you speak, your microphone will be activated automatically, so there is no need to touch the buttons. And if you would like to respond to a question, please raise your hand. And to the witnesses joining us remotely, please raise your hand. There is a screen in front of me that I can see you on, or preferably type R into the chat function if you wish to respond to a question or ask a question, and either I will respond to you directly or the clerks will alert me to the fact that you wish to come in. If at any point we lose the connection with you, I will come back to you at a later point. I'm going to structure the session this morning around 4 themes which are set out in the committee paper. Although it'll be a structured 4 themes, I'm really happy for us to have a fluid conversation and discussion today. So the rigidity will be around the 4 themes, but not actually within what we discuss during those periods. And as the committee paper explains, this session is part of a series of evidence sessions that the committee is holding on key audit themes. The work of this committee is directly linked to the reports of the Auditor General, and a number of those reports have raised concerns about incomplete or poor quality data and a lack of planning for outcomes. Examples include reports on early learning and childcare, on self-directed support, and on children and young people's mental health services. The focus of these sessions and this session today is to explore actions and steps that could be taken to bring about improvements in these areas, particularly given that the COVID-19 pandemic has highlighted the importance of accessibility and also of quality data. As these key themes have been repeatedly coming up in Audit Scotland reports, I'm going to ask the Auditor General to start the session with some brief opening remarks before we kick off on the actual discussion. Over to you, Auditor General.
Many thanks, Convener. Good morning, everybody. Public services exist to support and improve people's lives and well-being. Tackling priorities such as inequalities will take many years and decades to achieve. An outcomes-based approach helps to plan for the longer term, the changes that we want to see, and critically to demonstrate to all of us as taxpayers what has been achieved from public spending. Making well-informed long-term decisions relies upon having high-quality data. It's central to deciding what spending is needed, how money can most effectively be allocated, and how performance will be measured and evaluated over time. But it's not easy. Joining up data across different organisations and different sectors requires trust, strong and collaborative working. On top of this, maintaining a longer-term perspective when public services and finances are under short-term pressures, such as those we are currently experiencing, is ever more difficult, but it's vital that we do so. COVID-19 is likely to have long-term effects on people's lives, whether it's financial, physical or mental. Having high-quality data to measure these effects is crucial to making robust future decisions to help people recover and to improve their outcomes. Thank you, Convener.
Thank you very much for that, Auditor General. I suppose to kick off theme 1, which is the purpose and benefits of collecting data and planning for outcomes, I'd be really keen to hear, particularly from those organisations that aren't directly linked to the work of government, but obviously are involved in trying to hopefully move the government in the right direction. I'd be really interested to hear about the importance of data collection, the depth of that data collection, and how the data helps then shape your own priorities and your own working. So I'm really keen to speak to some of our external witnesses about that first and get a greater understanding. Anyone want to kick off? Alex Hutchison, seeing as you're right in front of me, you've got the short straw.
I can't avoid your eye contact there. So from my point of view, working on the Data for Children collaborative with UNICEF, we've got linkages with UNICEF, Scottish Government and the University of Edinburgh. And we're trying to look at a number of different types of data and how we can use those in new ways to improve outcomes for children. So that can be existing routine data that's collected within the public sector, looking at Scottish children's outcomes and having close linkages with Research Data Scotland, but also looking at what exists today in the data world. We know where there's swathes of data out there. So we're talking here about data collection, but it could just be access to data that already exists. The data is being collected, the quality of the data we know is an issue, but what we need to look at wider than just routine existing data, what novel data sets exist out there, from satellite imagery to telephone data, to survey data that's being run by loads of different organizations. How do we make that accessible? How do we make that people aware that it exists and that there's ways of tapping into it, that it can make a difference to people's lives if it's used properly and in the right way and safely?
Are you meaning, Alex Hutchison, not just government collected data, but data collection across the board?
Yes, yeah, absolutely.
And within that, is that around how that data is then presented?
Yeah.
Because sometimes it may be that the data exists, but it's just presented so badly that it's hard to use.
It's really hard to get a handle on what data exists across the whole landscape, if that's public sector, private sector, third sector. What data exists out there? Who owns it? How do you access it? How do you apply for access to it? What even is in it? What are the data variables and the catalogues behind it? That is a really hard thing to get a grip of because it's such a massive landscape. And we need to be more systematized in how we're presenting out that information to people so that they feel like they're empowered to then go and use it for benefit.
Excellent, thank you. I'm going to go to Linda Hutton next. Linda Hutton, particularly from your own work, I mean, every MSP will get data from your organisation and use that for local campaigns and what we pitch inside Parliament. So I'll come to you for your own reflections, and then I'll go to Claire Sweeney and Jennifer Wallace.
Certainly, yes. When it comes to the data collected by Citizens Advice Bureau, if one thing that the COVID pandemic has taught us is the increasing importance of that information that's coming through the door. However, in terms of access, I think we need to take one step back from that initially, because one of the things we work very hard at CAS is to maintain the quality and have a cycle of continuous improvement in not only the way that our data is collected, but the way that our data is analysed and understood. And from previous experience to CAS, I know that there are many organisations out there who already have a fantastic wealth of very useful data. What they're missing is someone in-house who not only knows how the data is collected and how it all relates to each other, but they can actually analyse that data and make it meaningful. Above all else, data tells stories. However, you need a particular skill set in order to make the data tell those stories. So it's my belief that more organisations than perhaps we believe actually already have the data. They're not ready for other people to access it because they themselves don't fully understand how valuable the information is that they have. And again, what stories that data actually tells. So I think for me and from my learning from CAS, before we get to the access point, we have to take that little bit of a step back and look to see how how organisations understand their data and what they actually do with that data.
Thank you, Linda Hutton. Claire Sweeney, you've obviously seen it from both sides, obviously having been previously with Audit Scotland, so no doubt written about the need for more quality data, and obviously you now have a key role to play around Public Health Scotland's own continuous data analysis, particularly in the COVID situation. So I'm sure you have some very interesting perspectives from both sides. So Claire Sweeney.
Thank you. Yes, a huge range of issues to talk about today, I think, but I just wanted to start from Public Health Scotland's perspective to acknowledge that there is much more work to be done. We are a relatively new organisation, but absolutely made up of some legacy organisations. So we're in the process of reviewing all of our programmes of work. And one of the messages across our organisation with our partners has been that we want to have a relentless focus on impact. And also, I think for me, a bit of humility about those other organisations that have already been touched on that actually have a history of doing this very, very well. So speaking to Penumbra this week, just by way of one example, and some of the questions that they ask the people that they work with are, what gives you a sense of hope? How do you live a good life? What do you need to live a good life? And traditionally, we've not been very good at asking those questions, but it is happening out there. So for me, part of the answer is a bit of humility about working with a really wide range of partners to bring all of that information and intelligence together to make sure that services are far more rigorously focused on making a difference. And that's part of what we want to help contribute. So we bring a certain amount of skills and experience to it, but we definitely don't have all the answers. So partnership for us is absolutely key in this.
Thank you, Claire Sweeney. Claire Sweeney, how much external requests do you get for data from organisations, say, or campaigners that helps them shape their work? Given that Public Health Scotland's obviously got loads and loads of data and people want to use it for campaigning purposes. Do you get lots of external requests?
We get a lot of external requests from the public and from organisations, particularly the third sector. I would say, though, that there's two parts to this. So one is all of the maybe more visible stuff about the big data sets that we publish routinely. So you'll be well aware that all of the cancer information's come out recently around COVID, etc. But for me, the much more interesting part of the job is all of the partnership working we're doing. So, for example, we work with lots of organisations around what makes a sustainable community, so what makes for good and healthy places to live. Now, our data is part of that, but it's not all of it. Another example would be we work very closely with all of the big charities looking at things like tobacco, drugs, alcohol, and we work with them in partnership. So it's about bringing all of that intelligence together. So rather than a kind of lobbying message, I would say the data is actually being used about what can make things better for people in Scotland. So a wide range of partnership working that goes on that isn't always national in its nature and not perhaps as visible as it could be. So there's something more we want to do around that, but lots and lots of partnership working going on to share the data.
Thank you. And I suppose there's a wider question about how much the data help shape policy making, but we'll perhaps come back to that. I'm going to hand over to Jennifer Wallace from Carnegie UK.
Great. Thank you, and it's a pleasure to be with you this morning and talking about this really important issue. I hope you are all familiar with Carnegie's work, but for those of you that don't, we've been, I suppose I would describe us as a critical friend of the Scottish Government on the journey around the National Performance Framework since 2010, when we ran a roundtable on measuring performance and social progress. So we've been on this journey, but we're also an organisation that covers the UK and Ireland and has an international lens. So I hope to bring some of that to this conversation too. So I very much agree with what Claire was saying about openness and transparency, and about the ability to use different types of data and to bring them together. I think for me, what we are missing, particularly in Scotland, is a structure of how we link our aspirations and the outcomes to what are essentially lag indicators in the National Performance Framework, to those lead indicators that we have a wealth of data on, which can be administrative or for other surveys, or as Linda says, some of our most timely data actually is collected by service providers and people at the front line. And at the moment in Scotland, we have no system for understanding that. So we tend to talk about data as if it is one big thing, rather than a data chain of understanding how these things can all be connected to build up a picture of what's happening in Scotland. And the other point that I would just make make is absolutely around inequalities and making sure that the data that we collect is good enough to address the inequalities in our society, because it's not always capable of doing that, and particularly when we're talking about some of our minority communities where surveys can struggle to pick up those numbers. Thank you.
Thank you, Jennifer. I'm going to hand over to Bill Bowman, MSP.
Thank you, Convener. Good morning. Can I just pick up on something Stephen Boyle said? He spoke about there needs to be a trust and strong collaborative working. Can I ask, just does blockchain feature in the future of data?
So I think you're right, Mr. Bowman. We've absolutely, and I think a number of the contributions already have talked about the need for that collaborative leadership and partnership working, that effective data collection through to the monitoring of milestones and ultimately the outcomes will not be achieved by one organisation alone. I'll say that probably I'll test the boundaries, I think, of my understanding of blockchain. I guess the implications of new technology are there, and certainly for my own profession, the auditing profession, and those of accountants as well, is that it will fundamentally change and make it, as I understand blockchain, a more open and accessible and visible set of transactions and data. So yes, that and other technologies will inevitably play a huge role in how we deliver, track and monitor data from data collection through to outcomes. But I must confess, Mr. Bowen, as you can probably tell, I think we're still thinking and grappling as to kind of what those new technologies might mean for our own work and data collection in the round.
Does anybody else want to chip in with a quick definition of blockchain?
Alex Hodgson.
I can give you my version of having tried to get my head around it and spent a few times reading articles and listening to conferences. The way I try and explain it in my terms is that it's another piece of technology, so one of many pieces of technology that gives us security and gives us trust in the transactional relationships of data. So it's not the be-all and end-all, it's not the panacea, it's a technology that happens to have an unbreakable code and algorithm around it that nobody could hack into, and therefore just keep certifying as data moves along that chain that I think it was Jennifer mentioned, the data chain, and making sure that data that's moving from A to B to C cannot be manipulated, cannot be handled incorrectly. So I think a lot of people refer to blockchain, but what we're really talking about is, can we handle data safely, and what are the technologies that are out there to help us to do that?
Thank you.
Thank you.
You're content with that response, Mr. Bowman? With that, I'll move on to Dr. Miller, please.
I just wanted to pick up on a couple of points that others have made. But first of all, maybe just to clarify what the Personal Outcomes Network is. Our focus in the network, we're a multi-agency network working across health, social care, housing and children's services. Our members come from across Scotland. And we tend to meet quarterly to try and focus on some of these types of issues, about how to get good enough data, about issues about recording outcomes for individuals within services, and also to a certain extent to using that data. So just reflecting back on what Linda was saying, I would agree there are a lot of organisations in Scotland who are currently working really hard to collect good personal outcomes data, but there are significant issues around analysis and use of that data. We do have some useful learning though in Scotland, because we had a project a few years ago called Meaningful and Measurable. Penumbra, who you've already mentioned, was one of the partners and 9 practice partners in that project. And we made quite significant progress within that year in terms of improving understanding of how to collect and record and use outcomes data. And one of the best features, the strongest features of that project was, in fact, partnership working. And there was something about getting different organisations in the same room every so often to exchange some of the challenges that they were facing with this whole agenda, as well as exchanging tips and tricks for how they had managed to progress. So I think the issue of working in partnerships is really fundamental to progressing this whole agenda.
Thank you, Dr. Miller. I believe Claire Sweeney wanted to come back in.
Accidentally asked to come in when I hadn't heard the end of the blockchain question, so I'm glad I avoided that. I think for me the key is the openness of data. That's the point I was going to make. And we have already, I've been with Public Health Scotland since June, and even in that time I've seen quite a significant stepping up of data being accessible and being quick as well. So trying to get that out as quickly as possible. So there's much more to do around that, but I think we are starting to really reap the rewards of some of the new technology that we can use around data particularly. And then just again to come back to that relationship point that's just being mentioned, and for me it's not an oppositional thing. We're trying to get people in a space where we are actually all trying to improve outcomes for people in Scotland. So there's no hiding, there's no, criticism of each other other in a constructive way. We need to work together and bring kind of all of our efforts together to best effect. So that's the way we're trying to move things forward.
Stephen Boyle.
Thanks, Convener. I think it's a really important point about trust and transparency of the data. And I think particularly the era that we're living in, about the level of scepticism, indeed, endless references to fake news about the quality of data that's been collected, how that is evidencing progress or otherwise. And that equally kind of supports the scrutiny that this committee and the Parliament will do, and also the accountability. It's such a key thing here that it really stems from just good quality data right at the outset, so all service users, participants can track and monitor, and actually there's almost one version of the truth. So I think it just, in the times that we're living in, I think it emphasises the importance of the high quality data, starting right at the collection point.
But just on that point, Auditor General, are you suggesting that the data exists, but how it's accessed, so the platform for which it's accessed and how people get to it and use it effectively, is the main barrier rather than the actual collection itself? I think it's both these points, Convener, actually, is about that really at the outset of kind of implementing policy development, policy changes, that, and I think it's a point that Audit Scotland's made over a number of years, actually, that designing in at the start high quality data, the collection methodologies, alongside the development of an implementation of the policy matters so much. I'm going to go to Linda Hutton and then Jennifer Wallace.
Thank you. It was just a very quick point on the access. Then it's something that CAS are working towards at present, as we're constructing, or we have very clever people constructing a data cube for us that will allow us to share a reasonable amount of data via a dashboard. So anyone from someone on the street through to these, our MSPs can access information directly. The one thing to mention on that, our case management systems are complex beast, to put it very politely. And our data is also very complex. So while we're more than happy to be open and more than happy to share our data, we still have to be quite cautious about what we put into the public domain, because some of it could be quite easily misunderstood. So while we are working towards this open access, or much easier access for people, I think there will be organisations like ourselves as well who still have to be quite careful about what is put into the public domain. And it goes back to what the Auditor General was just saying around the fake news issue. We have some figures that, in the wrong hands, could be wildly misinterpreted. And it's something that, because we're concerned about the quality of our data and what our data tells us, we're very, very cautious about what is released to the public domain.
Thank you, Linda. Just on that, Linda, how easy is it for you as an organisation to access public sector data, so government data, in order to help inform your own campaigning work?
We've never had any issue accessing that type of data. The things that we access most often would be things like the Scottish Household Survey, for example. And that is made available through the data bank, I think it's called. So we can access that quite easily. If we're looking for specific pieces of information, I would feel quite confident that I could go to the relevant people within Scottish Government and come to some kind of agreement as to, what we could access and where. I wouldn't see any problem with that at all. And reciprocally, we're always happy to feed into, if we can, we'll feed into anything, essentially. So there are quite a few projects and pieces of work, some by the Scottish Government, that we've fed into in recent times.
Thank you. Jennifer Wallace? Did you want to come
Thank you. So just a few additional points. On the data gap issue, we're part of the consortium that produces Understanding Scottish Places. And we have experienced significant difficulty in getting data at the level of Scotland's towns. As we are moving forward with our localisation agenda and with commitments to 20-minute neighbourhoods and so on, that data will become even more important. But just a reflection, our experience is that it's very difficult to get data at the lower super output area level to build up that picture. So where you can get, for example, population data, usually estimates from the census, or you can get economic data. Once you start going into social outcomes, it's incredibly difficult to get that in a comparative way. So just to highlight that as a specific gap. The other point that I wanted to make was from our international work. The data doesn't so much give you one version of the truth as help you have a shared conversation on why things are happening. And one of the difficulties we have as a society, and a lot of countries have at the moment, is flinging data at each other in an unconstructive way. Whereas if we all agree to, for example, the indicators in the National Performance Framework, or we understand why one type of data may be preferable to another type of data for the conversation, we can have a constructive debate on why certain indicators are moving in certain directions. And at the moment, that conversation is very difficult for us to have because of issues around data availability and actually, frankly, data literacy as well. So there's a whole, sort of suite of work that needs to be done to be able to get to the point where we can have that shared conversation. And it's one that I think Scotland has started well on. I used to be the convener of Evaluation Support Scotland. And in that role, working with a lot of third sector organisations, and say that there was a sort of sense of actually, there's a lot of rhetoric in Scotland about outcomes, but when it comes down to what's written in a contract for a third sector organisation, it's often not outcomes focused. That's not the data they're being asked to collect. They're being asked to collect output data, and they're being asked to collect, input data, how many people came to your courses, and those kind of issues. And I think, there is, going back to that argument about needing a golden thread, we do need some sense of, actually what do we expect all different levels in Scotland to be working to in order to build up a picture that actually means we're all working to outcomes rather than different parts of the system using different performance measurement systems. Thank you.
Thank you, Jennifer Wallace. I've got a supplementary from Graham Simpson. I see that Claire Sweeney and Emma Miller want to come in. I'll go to Mr Simpson first, and I'll ask that please Dr Miller and Claire Sweeney keep it really brief, because I'm keen that we move on to theme 2. They're probably we're probably rolled on to that anyway, but we'll formally roll into it. But I'll go to Graham Simpson first.
Thanks, Convener. I'll be really brief. It was just picking up on something that Linda Hutton said, and that was that data can be misinterpreted. Well, I guess it can, but there's also a danger, and we've had this debate in Parliament recently, that bad news in data can be sanitised, if you want. If you hang on to it for long enough, clean it up, present it in a way that you want to present it. So there is a danger of not just publishing the data as well. What do people think about that?
A very broad, open question, but I'm going to go to Claire Sweeney and Dr Miller, and then we can come back to this in probably the next theme, because it's part of our future discussions as well. So Claire Sweeney and then Dr Miller.
Thank you, and I'll keep it short just to say that that's clearly wrong. That should not be happening, and as far as I'm aware, is not happening with any of the information we have. We are bound by strict information governance and statistical quality controls, so we're happy to let the committee know more about that, but that should not be happening for our work. And just to also say that point about accountability, I think one of the issues we face is that people are just not held accountable. Jennifer mentioned this, but for example, what do our leaders across the system, what are they held to account for? Traditionally, it's been the things that we're very good at measuring, that we've got data around, and that really does need to shift if things are going to change.
Thank you. Dr Miller?
To make a point, referring back to the Meaningful and Measurable project, and in fact the work of the Personal Outcomes Network in general, that we tend to make a distinction between information for improvement and information for performance purposes. And it refers back to a point Linda Hutton was making earlier as well about that use of data for improvement. And that's where we found that in the Meaningful and Measurable Project, organisations were much more able to be honest and to exchange some of the struggles and perhaps some of their data which suggested things weren't going so well if it was in the context of improvement. But I think when there's a tendency to focus outwards for performance purposes, that's where that honesty perhaps, or the level of frankness perhaps starts to change a little bit because of a fear of blame or judgment, etc. So I think there's something about the culture of information use that we need to consider as well here.
Thank you, Dr. Miller. We're going to move on to theme 2, which is barriers to collecting good quality data and challenges to moving to an outcomes-based approach. I'm going to ask Alec Neil, MSP, who's joining us remotely, to kick off this theme for us.
Thank you very much indeed, Convener. Can I say that data, I think, is extremely important to good governance, whether it's the private sector, the third sector, or the public sector. And both as a minister and an MSP, down the years, it's been very frustrating the fact that the public sector as a whole doesn't have an IT strategy that would allow us to more efficiently, more cost effectively and more effectively collect the data that we need. I mean, a very good example of that is the National Health Service. There are 22, 23 boards involved in running the National Health Service in Scotland. The National Health Service spends about £500 million a year on IT systems in Scotland. And yet we are bedeviled by the fact that a lot of the systems don't talk to each other and therefore cannot collate the kind of data that we need and should be available for decision makers. And of course, that's been exacerbated in this case with the integration of health and social care, because the social care IT systems are not compatible with the health service systems, and very often the social care IT systems are not even compatible with other internal local government systems. So to my mind, that is the single biggest barrier to getting the kind of data on a regular basis, on a reliable basis that we need. And I would welcome the panel's comments on that issue about the total lack of a comprehensive IT strategy within the public sector. Across the public sector, we're probably spending well over £1 billion a year in Scotland in IT systems, and we ain't getting value for money because they don't talk to each other.
Who fancies kicking off on Mr. Neil's challenge? No one's oh, Alec Hutchison's volunteering. You have the disadvantage, Alex, of being in my eye line, so I'm going to go to Alec Hutchison.
So, yeah, systems not talking to each other is it's a problem, and it's a problem that is really, really hard to fix. And I say that from a sort of RBS background. So I used to work at RBS, where they had RBS and NatWest systems integrating. So it's just a little mini model of public sector where you've got a multitude of different organizations, legacy systems, and you're trying to tie them all together. And I think the learnings around that is what's a data strategy versus what's an IT strategy, and separating those two things, because the IT and getting the technology in place and the systems to talk to each other, which is a piping exercise. It's how do you get infrastructure built so that A does equal A in both systems. But the data, the actual core down to data variable, can mean such different things in such different contexts that people have to be really aware of what they're using it for. So if I think about public sector and some of the data variables that we might be looking to link up and have talk to each other, what somebody's filled in a form about early years funding responses on a list and a drop down and selecting and picking from lists, it might mean one thing in the context of performance and where a child's going in terms of performance, and it might mean a completely different thing to somebody in finance who wants to understand spend and how much we're putting out on those funding models. So breaking it down to make sure that those data variables that we're asking for and understanding why we're asking for them, and the data literacy piece, bringing that skill set and upskilling people so that they know why they're filling it out, why they should take the time, why they should care, because it will have this impact and this influence, 10 stages down the line.
Thank you. I'm going to go to Claire Sweeney.
Absolutely an issue. It's absolutely a problem. I'm kind of thoughtful about an experience I had when I was at Audit Scotland, working with a partnership, a very big partnership in Scotland around health and social care. And actually they had done a fantastic job with others' help to link up all of their data on health and social care. And we got very excited and thought, this is revolutionary. This is going to have all the answers. It will be great. And the message back from the partnership was this overwhelming. It's absolutely overwhelming, and they did not know where to start. There is so much information and data out there. So the technical issues about joining it up, particularly problematic in primary care, I would say, and we know that's a problem. It's not the only problem, though. The additional problems are about then, so what? What do you do with that information? How do you interpret it? How do you make sure that it's starting to lead to demonstrable changes? And so there's a whole package of things in there that are incredibly complicated, and many of which we are trying to help address through the contribution Public Health Scotland and others can make. So there's many and varied, but it's just to acknowledge it absolutely is an issue, and it's not the only problem we're facing.
Thank you. Linda Hutton.
And to go back to what Jennifer said earlier, and also what Alex was saying, absolutely, the lack of shared language and understanding around what data means is a huge problem to this whole concept of joining things up. Because no one measures things, people tend not to measure things consistently. What is A to someone will be X to someone else. We're so far away from joining up. And again, for me, it's about taking that step back and looking at the actual data that we hold and how we record it and how we have it speak to the needs we currently identify. When it comes to things like consistency, for example, within CAST, we keep an eye on the Scottish Census and the categories that are used within there. So broadly, our demographics will reflect the categories within the census. But I think you could probably pick up any 2 or 3 data sets from anywhere, and you'll find that there is that lack of consistency over things like age categories, for example, or the way that housing status is identified. So until we have that kind of consistency over the very, very basic items within data sets, then it's going to be difficult to actually have this joined up thinking. One other barrier to having a joined up service can be when it comes to funder requests. As you know, Citizens Advice Bureau are charities. We rely on UK and Scottish Government as well as the local authorities for funding. And when projects are put into place, sometimes the people who make the decisions on what needs to be measured aren't data people, to put it politely. They don't necessarily understand that what they're asking for doesn't actually meet the needs. What I would like to see to fix that is a little bit of a more open dialogue. What I would like to see third sector organisations like your own being able to do is when a funder comes to us with we need you to measure X, Y, and Z, for them to be open to us going back and say, well, we don't have X, but we have W. And W is almost X, and W will give you this. And be able to challenge what is being asked for in a constructive way so that we can create data that meets the needs of our funders, but is also accessible and understandable to a much wider body of people, essentially. Thank you.
Thank you, Linda Hutton. I see Jennifer Wallace and the Auditor General want to come in, so I'll take them first before going to Colin Beattie. So Jennifer Wallace, please.
Thank you. So just to build on some of this conversation, I think I'm thinking back here to time that I spent working with local government when I was working at the Scottish Consumer Council, so quite a while back now. But one of the difficulties that we had then was people talking about the importance of what I would now class as exceptionalism. So service exceptionalism, their service is different. They have to measure it in a different way. Their user group are different. And it's that sense of, you know, we need to do this our way. We need to build it from the bottom up that sometimes cuts into this, you know, collective understanding. So I think there is a way around that, but it has to be a very large conversation and you know, sort of co-owned, co-designed conversation around what are we measuring collectively? Why are we measuring it? You know, and make sure that we get that consistency. But if people aren't involved in that process, then they won't understand why the need for consistency is so much more important than the you know, sort of exceptionalism that they might have within their own service. And there have been so many attempts to do harmonisation over the years, and it's always incredibly difficult to do. So the other point that I would make within this is, of course, talking about IT systems, talking about the public sector there. So many of our services are delivered by third sector or private sector. So there's another layer of complexity within all of this, and then significant issues about data transfer that need to be overcome in order to make sure that we're getting that full picture of what's happening in Scotland. Thank you.
Thank you, Jennifer Wallace. Auditor General.
Thank you, Convener. Actually, I sense Mr Neil's frustration around it all, and given, I think, the recurring theme and the nature of this in terms of the committee's work. I think Alex makes it's an important point, actually, about, as well as the IT strategy, I think it equally applies about the data strategy, and both things really matter. I think what's interesting, particularly from public bodies' perspective, is that the quite wide and disparate nature of public organisations that exist in the country. We are only a country of 5.5 million people, and yet it would feel intuitively that this could be made to be work more straightforwardly than it currently does. I think one of the things we should be asking ourselves is about the kind of lack of progress that's been made around some of these shared services in the country. That, you know, there are so many different structures and infrastructure that exist as to why hasn't there been enough progress around kind of making the connections between the public bodies, and ultimately that will come down to leadership, the incentives that exist in different public bodies to make that kind of progress and step change.
Thank you. Colin Beattie.
Thank you, Convener. One of the things that's been consistent in the Auditor General's reports in the almost 10 years now I've been in this committee has been about data and the accuracy of data and how data is used to determine or validate policy. So on the one side, we get the data about the numbers, and that helps determine where resources are going to be put. On the other hand, and this is where I see it falling short, is we don't see the outcomes. Is that money being spent in a way that is commensurate with the outcomes that are being achieved? In other words, is the intended outcome being achieved? And consistently, we're not seeing that measured. And yet it is so important where scarce public funds are being invested that we have that information. Now, I don't know how that sort of cultural shift can take place, how we move into that particular field, because I don't see it happening in so many cases across the public sector and elsewhere. So I'd be grateful for the views of the panel on that.
Thank you. I see Claire Sweeney wants to come in.
Thank you. It's really important, and it's not been good enough. Absolutely can see that through the Audit Scotland reporting, if nothing else. For our organisation, we are just in the process of planning the new business and putting outcomes at the heart of that. So what difference is the work making, and being ruthless about trying to capture that information and report on it. So you'll see more on that in due course. But I also think there is a point again about how we recognise that it is so much more complicated than that. So I'm thinking about, for example, we've got a tool that won't just produce data on, you know, things that have happened, but increasingly trying to predict things that might happen relating to policy. So the tool basically takes in a lot of information and builds models, so people planning policy can use it to see if they do X, Y, and Z, what impact is that likely to have on inequalities? So that's exactly the kind of tool that we need more of to help support the development of policy and making decisions about various interventions across Scotland. And that's not just on health care, that's across the whole system. That tool's particularly used around factors to do with the economy. So we'd like to see more of that kind of work develop. So it's not just about reporting on the data, it's also about the how do we know what's happening in future. So it's really, really important we do more of that work.
Thank you. Linda Hutton and then Jennifer Wallace.
Thank you, Convener. Within CAST, we're really lucky we have such a broad range of data. We use it to feed into our policy work, our advocacy work, our campaigning work. One of the key things within CAST, I think, that makes a difference when it comes to the quality and importance of the data is the fact that our senior leadership team understands the importance of data and is happy to engage with the staff within the service that who understand the data, who interpret the data, who create the IT systems to hold the data, and listen to their knowledge and expertise in order to continuously improve and develop the way that data is collected and the way that data is interpreted. And it's something I wonder that may happen in, I would imagine, quite a few organisations. That data doesn't become important until something needs to be reported. So the annual report comes round and somebody goes, okay, we need data to explain this, this and this. All of a sudden they realise that perhaps they don't have the data that they need, or the data is not of an adequate quality to meet their needs. And so it's essentially what I'm saying is data isn't a part-time job. If you want good data, it's something that has to be dealt with daily. It has to be an ongoing process and not just something that's thought about when someone needs a report. Thank you.
Thank you. Jennifer Wallace and then Dr. Miller.
Thank you. So if I understand the member's comments correctly, we're talking about outcome budgeting, which I would probably more readily refer to as well-being budgeting, and there are developments in that field about how you shift decisions around budgeting towards the well-being outcomes that you seek for the population. Scotland is most definitely on a journey here, probably following New Zealand and their approach on well-being budgeting, and that's definitely a step forward on that, but it's an additive approach. It's not that structural change to how we think about budgeting and how we think about spending money. So the example, and I know there are reports that committee has considered around early years in particular. So one of the things that we're struck by as an organisation is that we don't know how much we currently spend on our youngest children. Now, we don't know what we spend. We can't begin to answer the question of whether we're spending it in an effective way. So we recognise that Scotland's on a journey to a wellbeing budget, and we recognise that it has a journey to go. But at the moment, there's no pathway between the traditional budgeting and the wellbeing budgeting. We're running a project with Children in Scotland, Catanach and Catherine Trebek, looking at how you can develop a wellbeing budget for the early years, and looking at thinking particularly about chunking the budget up for outcomes per population group. So we can't take the whole budget as one go. Maybe we can take a population group at a time and shift it towards outcomes. And the report of that will be out early next year, and we're very much looking forward to sharing our findings with you at that time.
Thank you. Dr. Emma Miller.
Just responding possibly in part to what Alex Neil was raising there around, mapping out intended outcomes in relation to any particular policy, I suppose at national level or on a kind of more local level, any programme outcomes. And I think we do have some progress in Scotland in the last few years around outcome mapping, which can involve diverse partners in coming together to identify what the intended outcomes are. And maybe just a couple of points to add to that is I think in association with that approach comes from contribution analysis, and there's a real understanding there that we're looking at the contribution of different partners towards outcomes, not attribution. So it's less of a kind of direct cause and effect approach than understanding how different agencies and indeed individuals can contribute towards outcomes. But I think also a really important part of that is that the importance of tracking not just the intended outcomes, but also being mindful of the unintended outcomes. So what additional benefits are emerging that we perhaps didn't anticipate in the first place, as well as perhaps some less beneficial outcomes. So it's just that kind of not just focusing on the outcomes that we think we're going to achieve, but keeping a broader focus.
Thank you. Alex Hutchinson?
Yeah, it actually is kind of aligns to Emma's point there around what we mean by outcomes and how measurable they are and how easy to measure they are. So it might be a number you could put on something. So like my goal, my ultimate success measure of what I'm doing is how many children's lives around the globe am I improving? And it's going to take me a lot of years to be able to come back with a number. So the way that we've broken down what our success measures are what are the things that will make that happen? So what are the inputs and outputs and outcomes that will have that ultimate, that impact? And if we're able to measure meaningful steps and changes that we're making in certain areas that we know if we keep nudging these parts on, so if we collaborate with a broader set of expertise, or if we bring in new data sets, or if we bring in new academic partners to look at different ways of modelling. If we nudge all these things, then we'll make a difference. So my recommendation in terms of the how are we measuring outcomes and impact from a data public sector point of view is make sure that you're looking at a step maybe before, because knowing that that investment has had that outcome in 10 years' time is going to be really difficult to measure and really difficult to be patient enough to see. But what are the things that will nudge it forward? What are the positive impacts that you're making from those investments?
Thank you. I'm going to go to Willie Coffey, who's joining us remotely.
Thanks very much, Convener. Good morning, and apologies for being slightly late to joining the meeting. A really interesting discussion we're having this morning about data, and one of the problems I've always encountered as an MSP is trying to get data that actually relates to my own constituency that I represent the Parliament. Often over the years, data comes out about this, that and the next thing, and when I usually ask the follow-up question, how does that affect my constituency, I can never get an answer. Because, Convener, it always relates to the local authority or to the Ayrshire and Arden Health Board, or used to relate to the different police boards and units, but never, ever to my own constituency or component parts of my constituency. So I was interested to hear some of Linda's comments there earlier about we can never get data based on a town and so on. The fundamental problem, I think, Convener, is collecting the data and tagging it where it came from. When you start collecting it, that enables you to build up a picture when folk like us come along and say, how does that affect my constituency or another member's constituency? We would be able to answer that. Now, it's not just the organisations here that face that problem. We have the same problem at Scottish Government level. How many times have we heard the message that data's not held centrally or something or other? So there's a fundamental issue about when we collect the data, we should also think about tagging it, like where it came from, what community or postcode it came from, so that we can build that picture up inevitably. So I was just wondering if the panel shared those views and what we should possibly do about it to try and improve it in the future.
Whilst I wait for someone to flag when I come in, I see Alex Hutchinson. Just to amplify Willie Coffey's point is, so often we do get that response back, and because there's different bodies involved in collecting different parts of data. So that is a real gap and a real problem, and one that I think fundamentally needs to be addressed. I see Alex Hutchinson wants to come in, and then Jennifer Wallace and Claire Sweeney. So there's some activation of interest. So I'll go to Alex first before we go to Wallace.
Yeah, it's a really good question, and it is a challenge. The data will exist. The data is there. They know where the data came from, but the complexity of who's collected the data, who owns the data, to what level of granularity the data is about a data subject and an individual, and therefore they've aggregated. Then local authority keeps it in one system, in one version and one set of data, and then they submit to central government, so they only submit a certain version. So there's so many hand-ins and handoffs and protection, rightly protection, about certain streams of data or certain pieces of information, but almost to the point where we're so cautious and so worried about GDPR and keep thinking of it as a preventer rather than a protector. So GDPR we should be using as a tool and an enabler to understand how to handle data responsibly. And I think we're, again, on a journey of learning how to do that properly. And that, again, goes back to data literacy and making sure that local authorities feel like they have a good grasp of the security of their citizens, to citizen.
Because Mr. Coffey will have had that problem long before GDPR came in. And those answers we get would have come long before GDPR came in. So I think the government could hide behind GDPR. But is it GDPR?
It's people protecting data, whether it's GDPR or not. It's people thinking, I cannot give that out. I have got to be careful. I will get in trouble, which is the right attitude. They've got to care about owning their data. But the way that we are collecting it, housing it, reformatting it, aggregating it, moving it around means that it loses a lot of its integrity as it's flowing around systems.
Yeah. I don't doubt that's true, and I don't doubt that GDPR is a challenge. But I think there is something about not wanting bad news data out there either. So I think we have to be alive to that fact. Jennifer Wallace and then Claire Sweeney.
Can I come back in, Anis?
Yeah, can I take? Do you want me to take Jennifer Wallace and Claire Sweeney, who wanted to respond to your first question, Willie, and then I'll get you back in? Is that okay?
Yeah, please. Thanks.
Jennifer Wallace and then Claire Sweeney.
Thank you. So on the cultural aversion to data sharing, yes, it did exist before GDPR. I think for me, it goes back to a very human response around people not necessarily understanding what it is they own, and what the proportionate risks are to sharing that, which leads them to be overly cautious about levels of it. Now, I'm talking particularly here when you're talking about population, not administrative case data about, children in schools, but, population level data for place, you get the same reaction from people, regardless of whether or not there really is a risk there in terms of exposing people's personal data. So I think cultural aversion. If I go to the experience on understanding Scottish places, which I was referring to earlier, to stress, in order to produce that, we needed to have a consortium of very committed people for at least a couple of years working on it, full-time staff working on it, in order to corral data into local areas. And what I think we reflected on, and others will have reflected on this as well from their experience, administrative data in particular is collected on administrative boundaries, but that's not how people live. People live in, towns and cities and places that they themselves relate to. So if we want to be talking about actually having a data conversation with the public, it needs to be on the basis of places that they understand, and allow them to, enjoy playing with the data and think about how it relates to their local area, rather than it being set up, at a level that has very, very little resonance to their own lives. So if you're in Greater Glasgow Health Board, that statistic doesn't tell you very much about what's happening in your community. And we understand so much more now about how people live in their local communities, and that sense of understanding place being really crucial, really to their ability to work together to improve their places. So I just wanted to provide just a little bit further experience on how we did that and how time-consuming it was and ought not to have been. Thank you.
Thank you. I'm going to go to Claire Sweeney, and then as Willie Coffey wanted to come back in, and so did Alec Neil. So I'll go to Claire Sweeney and then back to Willie Coffey.
Thank you. Just to say that the opportunity we've got now, particularly because of things we've seen through COVID, an increased focus on place and communities, is an opportunity to start to move this forward at pace, I think. Certainly a bit of work that we'll be involved in with our partners around thinking about what makes sustainable communities, 20-minute neighbourhoods, etc. So I think there's an opportunity to start to move forward much more fully around that. And I think for me, part of it is about why we collect this stuff in the first place. Are we really clear about the information is there to help support improvements for the lives of people in Scotland. And because we're not clear about that in all instances from the start, it means we often can't tell. And that's the issue we're dealing with. It's really complicated and very, very long-standing.
Thank you, Claire Sweeney. Back to Willie Coffey.
Yeah, thanks again, Convener. It's really not an issue about the GDPR. I mean, that's a recent thing. It's about understanding the boundaries and communities that we think are appropriate to tell the public something about them. And you won't hear me saying this very much, Convener, but our Westminster colleagues are far better at this than we are. Westminster always reports all its data pertaining to its constituencies that make up that parliament, but we don't. I could ask any question of the Scottish Government, of any of the agencies that are sitting in front of us today about any particular aspect of anything in Kilmarnock and Irvine Valley, and nobody will be able to give me an answer, because we don't recognise that as a boundary that we think we should report on. And it's kind of about that. It's about understanding the community boundaries that are relevant. Jennifer mentioned it there. So for me, it's just about understanding data and all the different community boundaries that we have in Scotland, and trying to be able to report data on that basis when people like you and I come along inevitably and ask what's happening in our own community. So it's kind of about that. So it's kind of good to hear that we do have the problem and people recognise it, but I'm looking for ways ahead, ways to take us forward to solve it, so that perhaps in the next Parliament that we're coming to, we can begin to actually tell people in the communities we live in what's actually happening in their community.
Thank you, Mr Coffey. I'm going to go to Alec Neil, then I see Linda Hutton wants to come in.
Thank you, Convener. I share Willie's frustration and the frustration of others in the panel this morning, because, quite frankly, you know, the head of statistics in the Scottish Government should be able to sort the problem of getting most stuff reported on a constituency basis. Can I look at the wider question where we could try, as a society, to organise data in such a way that we get maximum use of it without necessarily, you know, having to continually put more resources in and maybe not get the value for money that we always anticipate, because, you know, the Carnegie Trust and Allied CAB have highlighted their frustrations as well. It seems to me, Convener, that we should actually, as a committee, look, and I know we'll discuss this in more detail later, but I think maybe we could take a bit of a lead in this, in the sense that 2 points. First of all, data is, you know, this is not beyond the wit of man or woman. Data is collected at an individual level. We're all individuals. We all live in households, maybe a household of one, but we all live in households. Data can be collected at household level. Households go to make up postcode areas. Postcode areas make up health board areas, parliamentary constituencies, council wards, council areas, communities, community council areas, and all the rest of it. So it seems to me, if you start with the basics of the units of data and what we're trying to collect, there's a need for some kind of overarching framework at Scottish Government level, certainly to cover the public sector in Scotland, agreed with the public sector agencies, about how at least we could all collect data relating to each of these units, households, people, postcode areas, and all the rest of it, so that if you collect the data at postcode area, it should be easy to then put it into constituency level, for example. And it seems to me, quite frankly, this is not about GDPR. It's not about something that's impossible or expensive to do as a basic. It's about political will and the will of the civil service to do it. And I think, you know, the Scottish Government's the ideal body in Scotland. We're a small society of 5.4 million people. It should be easy to do. Every other country seems to do it a lot better than us. And I think if we get an agreed framework, which people collecting data throughout Scotland could then use, and knowing that everybody's working to that framework, then, you know, through time, I think we can get into a much better position. I don't underestimate the difficulty, but at the same time, I sometimes think we build a mountain out of a mole. It's not a molehill, but it's certainly less than a mountain.
Thank you, Mr Neil. I'm going to go to Linda Hutton.
Thanks, Convener. Just to go back to Mr Coffey's point about reporting at constituency level, we do report regularly at both Holyrood and Westminster constituency level. We're lucky that we have a data set large enough to be able to do that. It's only where Bureau aren't represented, excuse me, that we can't provide this. But we can come across difficulties, if anyone would come across difficulties reporting at constituency level. It's down to the specificity of the question. The more detailed information you want, the more likely the sample is to be too small to report on. So, for example, we could say that within Mr Coffey's constituency, X number of people sought advice on benefits. We couldn't, there's the potential that we couldn't say how many people sought advice around the young person's grant who lived in a particular area of that constituency, because it may take it down to just a handful of people, which again, when it comes to GDPR, we can't stray into that territory because we risk identifying individuals. Primarily, I just wanted to share, Mr Coffey, if you want to come to me at any point in the near future for reports on his constituency, I'm more than happy to provide them.
Thank you, Linda Hutton. Linda Hutton, one of the reasons why we were keen to have you on this panel is because Citizens Advice Scotland is a good example of how we can break down data by constituency and local area. And our wish is that we could have that much wider across the board and across the public sector in general. I think that is a general demand from all right across the Parliament. I'm now going to ask Graham Simpson to kick off theme 3, how to improve data collection and planning for outcomes.
Yeah, but before I do, I've got to say about Citizens Advice, the information that I've had from my local office, which is East Kilbride, has been very, very good over the years. And they do provide local information. So I think, I think it's an excellent organisation and very helpful, and they do appear to be able to share useful statistics. So maybe there's a message there for others. I think what I want to do is explore how we get better, and if I can refer to one of the reports that the Auditor General, I think it was your predecessor Auditor General, did on city deals. And I think this just makes, I'm not asking you to comment on city deals because you might not know about them, but it makes a general point that city deals, a collaboration between the Scottish Government, UK Government and councils, where we're spending an awful lot of money. But one of the criticisms has been that they don't appear to have set out at any point what they want to achieve and how that should be measured. So we've seen a number of projects in my own area where millions of pounds have been spent on road projects for no obvious benefit to anyone, just for the sake of it. And there'll be other examples around the country. So I just think, do we need, when we're spending lots of money, to establish at the start, before we spend the money, what it is we want to achieve and how we want to measure that? So I'm not asking you to comment on city deals specifically, unless you want to, but do we need to just get things right at the start before we actually spend the money?
Thank you. We'll go to Claire Sweeney first and then Jennifer Wallace.
Yes, we absolutely do. And I think we can help support organisations to do that across a whole range of service areas. So thinking particularly about the city region work, we are working with a couple of partnerships around exactly that issue. How do we get in the public health voice? How do we have a clear focus on outcomes? If not from the start, then how do we do it as soon as possible? So yes, it should be absolutely built in from the beginning. And on the issue that was just discussed around the levels of data, I just wanted to come in briefly and mention that for some areas we do have an enormously detailed amount of data. So thinking about the health system, we can tell you by individual, and then we can look at postcode and we can cut it in so many different ways, but that's not true for most parts of the public sector.
Thank you. Jennifer Wallace.
Thank you. So I think, particularly thinking about the budgeting side of it and large expenditures, there are a couple of things that we could do collectively to improve. One of them is just back to that point about openness and transparency. I've been working for NGOs now for 20 years in Scotland. I've never seen a pre-expenditure assessment. So it's very difficult for me to know how the government goes about doing this and what, as an outsider, we can contribute if we're not able to look at the evidence and the data that is being put together in order to propose things for spend. So there's an openness and transparency point for me at the heart of this. The second one is that Scotland has a public finance manual, which I'm sure you're all familiar with. It was, of course, updated for the NPF, but in my view of it, it wasn't substantially updated. It wasn't significantly updated. It was more, and here's something that you might need to think about, rather than a theory of change about how you go around putting inputs into the system through the financing of projects in order to achieve the outcomes that you seek. And in that, particularly, the Public Finance Manual still points to the Treasury Green Book. The Treasury Green Book has some additions around social value, as you would expect, and about wellbeing measurement and the role of subjective wellbeing in that. But that's very much driven from the perspective of the UK government approach. It's not driven from the perspective of the Scottish government outcomes approach. So if we were able to have a manual that really nailed the question of how you understand that theory of change for outcomes, I think we would see improvements in the whole system. Thank you.
Thank you. Does anyone else wish to come on this, Auditor General?
Thank you, Convener. Just building on Jennifer's contribution, something actually the committee will be familiar about Audit Scotland's reporting, I suppose, on how money has been spent, how well it's been spent, and the connections between the National Performance Framework and its own financial reporting. So Jennifer's quite right, is that I think even if you look at the Scottish Government's consolidated accounts, is that it tends to report on, I guess, fundamentally that the Scottish Government has broken even and the measures which is held to account. What we don't see yet is a clear enough connection between the consolidated accounts and Scotland's wellbeing, which is the report that kind of sets out how the country has performed against the National Performance Framework. My predecessor called repeatedly to kind of make better use of the consolidated accounts, the performance report, that it sets out what's been achieved in terms of outcomes for the 40+ billion pounds of public expenditure. So there's a way to go on that front. And really just to agree with Mr Simpson's point is that when designing complex policy, the outcomes, and as we talked about a number of points this morning, is that to be captured routinely in the design phase and the milestones and the reporting thereafter. You mentioned city deals, Mr Simpson, but I think the point equally applies into the other comparable report, which was the expansion of early years childcare provision in the country as well.
Or just on that, I mean, you and your colleagues have written multiple reports which talks about leadership, which talks about different parts working together and the collation of data, the need for collaboration, the need for necessary skills. Do you want to amplify that a little bit more, just about what you mean by that in practice and what kind of change you think is needed across the government?
Yeah, happy to, Convener. I think we touched on a couple of points already this morning about culture. Actually, just about how is the implementation of projects measured? What are the incentives for leaders across the country? How is their performance assessed? And I think too routinely, we've made great progress as a country in terms of the National Performance Framework and starting to move away from inputs and to an extent outputs to the aspiration around outcome measures. But there's still a way to go. And I almost kind of think it now feels like a period of time to take stock as to whether the infrastructure around our measuring and reporting is sufficient to make the kind of step change that I think we all believe in, and the Parliament itself, of course, signed up to the National Performance Framework. And I think it comes back to whether it's the Public Finance Manual, whether the role of the accountable officer, but it all matters and it all counts. And again, to the Parliament itself and the various the boards and committees around the country, that they're equipped with the right tools to actually measure outcomes. At the moment, it doesn't feature prominently enough in terms of the conversation that various public bodies around the country is that what are the outcomes for the organisations that they're supposed to be delivering. So it's really complicated. I think we've kind of seen that through this morning's conversation. But I think where I come back to is that, and it's touched on a number of points also, is that a country of our size, should feel intuitively that we can make the kind of steps that can actually show the transparency and appropriate comment around value for money of what's been achieved for the money that we're investing in public services.
But going back to what Alec Neil said quite rightly about the political will. So what's the blockage? Because if we've had consistent, and as Colin Beattie said, 10 years, and that's just the time that Colin's been on the committee in terms of consistent issues being raised about the need for proper quality collection and dissemination and sharing of the data, need for adequate skills, need for adequate leadership. What's the blockage? Is it simply just the will question, or is there a layer underneath the will question that also needs to be resolved? I'll let you respond to that, Auditor General, then I'll go to Claire Sweeney.
Yeah, thanks, Kevin. I think it's incredibly complicated. Again, it's undoubtedly cultural as well. I think there is, if I recall, I think the committee asked a similar question of my predecessor on some of this theme as well, about the extent to which some of these brave decisions will need to be taken and a consensus built around it. I think the Key Themes report, for example, talks about police numbers as being a good example, that to an extent the measure of success is often held around, well, the number of police officers we have in the country, as opposed to shifting on to outcomes that the police service is delivering upon. And the same equally applies to some of the performance measures that the NHS is held to account, that for the government and other members of Parliament, actually, that there can be a consensus around the functions and delivery of these organisations. So I do think it's a will and leadership from across the Parliament and also from the civil service and public leaders too.
And when you say culture, what do you mean by that? Is there a bad culture just now in data collection?
I think culture is what it is, Convener. But what we are seeing is that, and you maybe come on, it's that short-term pressures, actually, and the extent to which they're rubbing up against the ability to step back and say, well, what can we deliver in terms of more medium and longer-term deliveries? How will people? I think it goes back equally to about how we're assessing performance and how people are held to account, whether it's public leaders or politicians. So in the short-term nature, and I think equally as a question or a statement, is that getting in the way of making some of the longer-term changes that would have?
And do you think Graham Simpson's point about it's about wanting to avoid bad news stories or delaying bad news stories? So like if something's hot, taking 3-4 months to collect the data and get the data analysis out there, the story's moved on, the world's moved on. Is there some truth to that?
I think I probably have to kind of think specific examples. I mean, I can understand why there'd be an incentive, perhaps, for people to behave that way, but I think, as others have said, that there's an ethics around some of this, actually,
yep.
that it's kind of taken out the hands of, for those that have disincentive with timing of reporting, actually, that, again, look at the outset, so in designing and commenting on a project, that we know when we're going to report, so it's not that it kind of, as I say, it takes it out of the hands of the individuals to manage the message that a project will be clear about when it's going to report milestones throughout the duration.
Okay. I'm going to go to Claire Sweeney and then Linda Hutton.
Thank you. Very similar points to the Auditor General. For me, part of the problem has been too much of a focus on the short term and the reactionary stuff. Not enough of a focus on the longer term aims and sticking with it, because some of this is generational change, and that's very hard when we're trying to demonstrate year-on-year impact. So the approach that we're taking is encouraging teams to think about the short-term impact that can be made, the medium-term and the longer term. It's not that we won't be able to demonstrate any change over a generation and then the kind of switch goes on and it's fixed. So there are steps we can take in the interim. And so I think there needs to be a recognition that for some things, they just will not be achieved until much further down the track. But that doesn't mean that we're not doing the hard work now that needs to be in place. So that longer term planning is key. I also think for me, there's something about it being really hard and therefore perhaps not as much of a pressing priority as other things have been. It's such the pressure around particularly COVID, I would say, and the reporting and the impact on all of our lives and services has been really significant. So I think for us, we're trying as an organisation to deal with the COVID response, but not to lose sight of the much, much longer term, and you could argue more important, actually, impact that COVID is going to have, and therefore the impact on inequalities and our role in helping to reduce some of that over time. And then finally, I think there's a whole load of legacy issues in all of this, and it's really, really hard to switch some of that stuff off. So again, I think there needs to be a bit of bravery around saying, actually, that was fit for purpose before, but we're in a very different place now, and we'll be rigorous about challenging ourselves. Do we need to stop, or do we need to do things differently?
Thank you, Claire. I'm going to go to Linda Hutton and then Dr. Emma Miller.
Thank you. It was just to add briefly to what the Auditor General was saying. Some outcomes take a long time to be achieved. So when you have, for example, if there are short-term projects with short-term funding, it can be incredibly difficult to report on the outcomes that people think you should be able to report on. I'm thinking of an example from before I came to CAS. I did some work around addictions. It's unrealistic to expect someone with a long-term addiction to fully recover within a year. So if you have a short-term programme that says, okay, we want an outcome to be that this person is, for example, no longer using drugs at the end of 12 months, that's not going to happen. So it's about having outcomes that measure the short-term, smaller gains can be very important rather than the very, very long and medium-term outcomes. Thank you.
Emma Miller.
Just following from previous contributors there, I think the issue about performance culture and the focus of that and how that can distract from some of the potential benefits of a focus on outcomes in general. So I think coming from a personal outcomes network point of view, that network is really about focusing on changing practice at the front line. And I think there's something important in there about being clear about what outcome focused practice means. It involves a shift away from focusing on needs and deficits of people to focusing on what their strengths are. And it means changing the conversation to flow with that. And that takes a long time to change that culture in organisations. I have to say that I think Scotland is doing really well in terms of outcome focused practice, although there's quite some way to go. But there is something in there about the need to have a performance culture which supports meaningful conversations rather than constrains conversations by putting in place measures which don't support that. And there are equalities issues attached to that as well. Those meaningful conversations which are tailored and adapted to the individual allow for more meaningful engagement with people, like, for example, with addictions, people with traumatised backgrounds, people who need that more detailed approach to engagement. And I think there's something in here about facilitating that rather than having performance indicators which work against it.
Thank you. I was going to move on just in the final minutes to theme 4, which is around COVID-19, but I'm going to take Willie Coffey first to see Willie Coffey wants to come in.
Aye, thanks again, Alice. It's just on the point about constituency boundary data and stuff. Public Health Scotland's got a brilliant database that's shown us all the COVID data, and we're coming to that topic next, convener. And you can drill in and you can look at communities and very small communities to see what's happening. But the point I've been making throughout this discussion is, if I was to ask, what is the picture in the Kilmarnock and Irvine Valley constituency? It doesn't tell you, it rarely tells you that. So you can see communities at a kind of smaller level, but you can never ask what the picture is in your own constituency boundary. That's kind of pretty common across the board, and if Citizens Advice have got it on a per constituency basis, that's brilliant. But in general, nobody provides that, and it's just something that I think we should aspire to in the future.
I think all parliamentarians certainly would wholeheartedly agree with that, Mr. Coffey. I'm going to move on just as in our final minutes to talk about the impact of COVID-19, which is theme 4. And I suppose what the reason why that's been added is clearly the way we collect data, the way we disseminate data, the way data is involved in really fast decision making and in policy making, and how we scrutinise policy making has been moved into sharp focus by COVID-19. So just a moment to reflect on that, and I suppose that's more a first direction, most obviously towards yourself, Claire Sweeney, because obviously Public Health Scotland is a key part of that. How much is quality data, speed of data, helping to drive quick decision making and policy making, and how can parliamentarians help use that data in terms of holding those decision makers to account and hopefully constructively challenging at the same time?
So I'll start by saying that COVID has obviously been incredibly difficult, some really heartbreaking impacts on families across Scotland from COVID, but that immediate threat to health and life is not the only concern. So we are equally, some of us more, concerned about the longer term impact on the people living in Scotland. So the indirect impact of COVID on health and well-being, on health and care services, again, you've seen the recent cancer statistics that we've published, on the economy and on wider society are absolutely significant, long-term and enduring. It was already difficult in Scotland in terms of inequality, as the committee well knows. And Public Health Scotland was indeed established to help try and move that on, which is the work that we're actively involved in at the moment. You'll not be surprised to hear that COVID has not been the easiest start to establishing a new body, and we have shifted a large proportion of our resources to the immediate COVID work. And I probably wanted to highlight to the committee the ways that we're doing that. So firstly, we're helping organisations to make decisions about how to respond. That's at Scottish Government level, but also all of our public bodies and communities as well. That includes things like the national data that you've mentioned already, that you'd be familiar with, but also advice and guidance to communities, not just on COVID and sort of trying to contain the spread of the virus, but also on things as broad and wide as encouraging people to take more physical activity, the impact of people being stuck in their own homes, and trying to minimise the health impact from that. So a huge, wide and varied amount of work going on around guidance and data, etc. Also, we're helping support the limitations and containing the spread of the virus. So we support the test and protect approach, as the committee knows, and we help local and national bodies through our public health scientists and our expertise to advise people about how to respond to local outbreaks. And you'll not be surprised to hear that's been a very significant part of our work. We're working with all partners to think about recovery and renewal. So how do we get, for example, the health system back up on its feet? How do we help partners find evidence-based solutions to build in resilience into communities locally? And then finally, just to mention, helping Scotland prepare for any future outbreaks and keeping a very close eye on certain other issues that are prevalent across the world, actually across the globe. So I could talk at great length about that, but I hope that gives the committee a good feel for the sort of range of work that we're involved in at the moment.
Thank you. Jennifer Wallace.
Well, firstly, I think I would like to say just on a personal level how much we from the outside of government appreciate all the work that's gone on to try to create accessible and timely information on the pandemic so that we can understand what's happening as citizens, really. So thank you for all of that. My comments are really about the next stage rather than what's happened over the past 9 months. And I think one of the sort of issues that we have in terms of planning for recovery when we do get there is that we have a history of privileging our economic projections rather than our health projections or other social outcomes. And I think that's something that in this case we really need to think long and hard about because we understand far better from what's happened in the pandemic the relationship between our economic outcomes, our health outcomes, And what we expect is that and I'm sure colleagues at Public Health Scotland will agree with this, that the economic recovery may happen faster than the social recovery. The lag may take a lot longer. The scarring effect that we know that happens from unemployment, for example, the long-term effects of mental health issues, go on for many years. So we need to be careful in our construction of, the recovery, and our construction of how we think about evidence going forward, that we are giving equal weight to the evidence that we have and the predictions that we make on health outcomes and other social outcomes, even recognising that they are much longer term. And I think if we can find ways of having that conversation collectively and collaboratively, that would be incredibly helpful. Thank you.
Thank you very much. I'm conscious of time, so I'll take any final reflections from any members. Alex Hutchinson.
I was just going to mention about the COVID question and your reference to good quality data driving decision making. I think the key for the public is the trust that they can have in government decisions if good quality data has been used. So having that transparency and that openness as a continual message in terms of communications and decisions, I think tying those together is really important for people.
Thank you very much. Any other people that are joining us remotely want to make any final comments? No? Excellent. Then before I close this session, I'd like to invite the Auditor General to reflect on the issues discussed this morning and draw out some of the key points.
Many thanks, Convener. I think it's been a really full, very open and interesting conversation this morning. I think that very many points are interesting, I think, kind of flow from the committee's own report on the key themes. I was struck, I think, a number of things just touch on briefly about the importance of data skills, firstly, as well as something that we perhaps take for granted, that Linda quite rightly makes, that actually we need to ensure that, how we're using and equipping all of us with the right skills. We talked also about the transparency of data and its use across the system, and how much that matters, really from project design through to the milestones and reporting of the outcomes that flow thereafter. And I think that also bridges into some of the point you've mentioned a couple of times, Convener, about the availability and the clarity as to when data and information is going to be reported, that's owned by everybody and not necessarily just those who are in possession of the information at the time, so that it's clear to all users of information when that comes through. I think we've also heard about the complexity of the landscape at times getting in the way of things with the number of organisations. Absolutely the importance of partnership working and that collaborative leadership. Really, absolutely from the Scottish Government, from public bodies too, and the importance that our third sector colleagues play as well. Intuitively, it feels like a country of our size can do this and can make a difference. As Jennifer mentioned, apologies, Emma mentioned earlier, we've undoubtedly made progress as a country, but it feels like there's more opportunity to do so in how we report our public information against outcomes. And lastly, to acknowledge of course, the terrible impact that COVID has had on individuals' lives. And the economy too, no doubt, for many years to come. But some of the risks that exist currently too around that the short term can get in the way of the long term. Examples we've seen in the past that, yes, we know that decisions are being taken at pace at the moment, but that for us to hold on to, and as Claire rightly says, that we can't lose sight in some of the pace we're taking decisions, but the longer term implications, and sustain the progress that we've seen already, Convener.
Thank you much, Auditor General, and with that, can I thank you for your joining us this morning, but also Alex Hutchinson, Linda Hutton, Dr. Emma Miller, Claire Sweeney, and Jennifer Wallace. I thought that was a really fruitful discussion, and a genuine thank you to you all, and we look forward to following up in the weeks and months ahead. And with that, I now close the public part of this meeting as we move into private session.